Hello, my name is Caitlin Duggar, and today I am presenting the evidence-based project grant proposal on transient tachypnea of the newborn treatment methods. For my qualifications, I am an RN BSN who is currently working toward my nurse practitioner. I work on a postpartum floor at Lowell General Hospital where I hold my certifications of BCLS and NRP. I have been at Lowell General for over a year now. I occasionally work on the special care nursery unit where I have experience dealing with newborns diagnosed with transient tachypnea and use treatments such as nasal cannula, CPAP, and different types of medications. Transient tachypnea of the newborn, or also known as TTN, is a respiratory disorder that is usually seen shortly after birth, categorized by rapid breathing. TTN is usually short-lived but can be life-threatening without treatment in severe cases. TTN is a form of respiratory distress caused from the reduction of lung fluid clearance resulting in tachypnea, grunting, intercostal retractions, and nasal flaring. Transient tachypnea of the newborn is treated with different types of medications such as salbutamol and budesonide. It is also treated with mechanical ventilation such as continuous positive airway pressure, also known as CPAP. The purpose of this study is to examine the relationship between different treatment methods of transient tachypnea of the newborn and to compare which treatment methods yield better outcomes for newborns. Some identified objectives are 1. To explore the different treatment methods for TTN, 2. Identify which medications are given to treat TTN and their effectiveness, and 3. Identify if medications used in combination with CPAP result in better outcomes and less time on CPAP than if CPAP was used alone. This is done by performing a thorough chart review. The identified gap in current research is if medications help newborns wean off of CPAP faster and more efficiently than if CPAP was used alone. Recent literature does not have studies that use CPAP in combination with the identified medications. The two variables are separate. The literature exploring medications to treat TTN in combination with CPAP is limited. Current literature does not examine if the medication given during CPAP helps the newborn get off mechanical ventilation. There is a gap of current literature for weaning criteria from the mechanical ventilation and a gap in the criteria of when to start mechanical ventilation because the medications are not sufficient enough to treat respiratory distress. Next, I will discuss the proposed project methodology. The method of the study is to do a retrospective chart review to look at the treatment methods provided to newborns diagnosed with transient tachypnea. This chart review will be verified by two different researchers. This research design is descriptive as I am attempting to describe the different variables or treatment methods of transient tachypnea of the newborn to see which treatment option yields better outcomes. The treatments have already occurred to the newborns, which we are reviewing what treatment methods were performed and the outcome and the respiratory status of that newborn. Respiratory status will be evaluated using the TTN score, which includes expiratory grunting, supraclavicular retraction, subcostal retraction, cyanosis, and nasal flaring. These categories are scored as shown in the table here. For the sampling method and participant recruitment, the hospitals the participants were chosen from were Boston Children's Hospital in Boston, Massachusetts, Tufts Medical Center in Boston, Massachusetts, Brigham and Women's Hospital in Boston, Massachusetts, Bay State Medical Center in Springfield, Massachusetts, and Beth Israel Deaconess Medical Center in Boston, Massachusetts. This study is purposeful sampling as participants are selected based on certain characteristics that meet the objectives as identified earlier in this presentation. Inclusion criteria for participants included that the newborn is diagnosed with transient tachypnea while in the hospital, the newborn was treated between 2016 and 2021, the newborn was under 2 months of age during treatment, Newborn was given medication in combination with or independent of continuous airway positive pressure or CPAP to treat the transient tachypnea while in the hospital. People will not be eligible for this study if the newborn was given continuous positive airway pressure without any additional medication to treat transient tachypnea, and the newborn was transferred to another facility for further treatment. This study is significant to nursing because identifying the proper combination of medication and mechanical ventilation can lead to effective and safe procedures in all settings. We can ensure we have proper equipment set up and start treatment based on an algorithm once identified which combination of medication and mechanical ventilation is best. There is a gap in the current literature for this topic because no current studies analyze the newborn outcome if treated with medications and CPAP at once. The current literature analyzes medication and CPAP separately and does not evaluate the effectiveness when used together. It is also significant because being able to identify the best treatment improves clinical symptoms and provides support to the infants. This will increase expertise and experience for this phenomenon and reduce the need for NICU care. For innovation, COVID-19 has unfortunately put machines in high demand, so we need to have a set of requirements to put a newborn on CPAP and have the best treatment method combination to help them get off CPAP quicker. By making a standardization of care or having a proper algorithm, we can ensure newborns are not being put on CPAP unnecessarily and making sure that they are weaned off CPAP when the time is appropriate. We are aiming to use medication and mechanical ventilation together to decrease the time on the mechanical ventilation such as CPAP, as the two treatment methods have been separate in the past. We are aiming to have a better way to cure and treat this disease. This project should be funded because having a standardization of care that follows evidence-based practice can help keep treatments up to date using the latest research. This also ensures we are providing the best care and treatment to newborns experience this phenomenon of transient tachypnea. TTN can be life-threatening if not treated correctly. So having the proper funding allows proper treatment to help save the lives of newborns experiencing this disease. Treatments are always changing, and we must remain up to date with the latest research to discover the best outcomes for newborns. Thank you very much for your time and consideration.